So the four common misconceptions about Medicare plans. You have to buy a Medicare supplement plan right away. You can't get into one later. That's true. Um, you that's a misconception. You can buy a Medicare supplement plan later, but the problem with buying it later is you have to go through medical underwriting. Okay. If you're in pretty good health, and you decide that you want to get a Medigap plan later, you can certainly go through medical underwriting and then see if you can pass underwriting. So if you don't have any health challenges, um, then you can delay getting a Medigap plan until later. But just remember, the best time is in that initial enrollment period because then you don't have to fill out any underwriting questions. The second misconception is Medicare Advantage plans do not cover as many services as original Medicare. That's also inaccurate information. Okay. Like I said in the beginning, both plans will cover your needs. They just do it two different ways because the Medicare Advantage plans have to cover what original Medicare says. They just offer extra things. Third misconception is you have to pay your out-of-pocket maximum, your MOOP amount every year. That's a real misconception. What happens with your maximum out-of-pocket? That's a benefit that we gained from the Affordable Care Act legislation. What happens is people were losing their homes and life savings because they were spending large amounts of money with healthcare costs. So what happens through that legislation if you have a challenging year and you spend the dollar amount, say halfway through the year, your maximum out of pocket is $7,000. And if you're at June and you've already spent $7,000 for medical expenses, the clock stops ticking for that year and you won't pay any other co-pays for that particular year. Now the clock restarts again in January, but as soon as you hit that maximum out of pocket during that calendar year, because these plans are based on the calendar year, then you don't pay any co-pays for medical. And the fourth misconception is most people have Medigap plans because MA plans aren't as good. That is inaccurate information again. So the best way I explain this to people is, again, they're two different plans. They operate two totally different ways. So I always tell people, if you're a person that you would prefer to pay a higher premium up front so that you don't have co-pays as you go along, okay, then a Medigap plan would be better for you. If you're a person that wants to pay a smaller premium or no premium at all, and you want to have your dental, hearing, and vision all bundled in your plan, then an MA plan may work better for you because you would pay little to no premium per month, and then you just pay co-pays as you go along as you need services.